SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts Programming. Good, useful, and full of wonder. SDPB.
Good morning. We'll call Senate Health and Human Services Committee meeting to order. I'd like to welcome everybody online, welcome all those in the room, and all those that may be watching our streaming service now. So want to remind everyone to please turn your cell phones to silent so we don't have any disruptions. And with that, I'll ask the secretary to call the roll.
Senator Grove. Excused. Perry.
Here.
Reed.
Here.
Smith.
Here.
Voigt.
Here.
Davis.
Here.
Jensen.
Here.
Mr. Chair, we have a quorum.
Okay, thank you. With that, I'd ask for a motion to approve the minutes from the previous meeting. Senator Perry moves, seconded by Senator Voigt. All those in favor say aye. Aye. Opposed, nay. Great, the minutes are approved. I want to remind everybody to sign in at the podium here if you plan to testify, or you can use the QR code and do it on your phone. Also, of course, the lobbyists have heard this many, many times over this year. Please have your proper credentials when you come up. If you're an individual wanting to testify, please push the button on the microphone, introduce yourself and who you're testifying on behalf of, whether yourself or for an agency. And with that, I'd like to have the pages come forward and introduce yourself, where you're from, if you have future plans. Don't knock each other over hurrying. Okay. Okay, thank you. Go ahead and push the button. Yeah, there you go.
Hi, I'm Lindsay Ronning, and I'm from Hill City High School, and I'm a senior this year. I plan to go to South Dakota School of Mines and go into industrial engineering.
Oh,
I'm Layla Williams. I'm from Hill City, South Dakota. I'm a senior in high school. After high school, I plan to attend Flagler College in St. Augustine, Florida, majoring in political science, and then get a law degree somewhere.
okay. Thank you very much. And welcome to your first days here. If another reminder, if you have any handouts for the committee, please have the pages distribute those for you. So I guess with that, any introductions or personal privileges from the committee? No. Okay, thank you. So we'll get right into the first bill here, House Bill 1104, revise the application requirements for special license plates and parking permits for individuals with disabilities. Do we have any proponent testimony?
Good morning, Mr. Chair, members of the committee. Senator Sidney Davis, District 17, Burbank, South Dakota. All right, so HB 1104, this bill would authorize PTs, chiropractors, physician assistants, and certified nurse practitioners to certify applications for disability license plates and the parking permits you see hanging from the rearview mirrors. Currently, only physicians can certify these applications. Several states already allow physical therapists and other qualified health providers to do these types of things. Those would include our neighbors to the north, North Dakota, over to the east, Minnesota and Iowa. Expanding this list of certifying providers just kind of eases that administrative burden on our physician colleagues and makes it easier for disabled people to find to file the application for that special license plate or parking permit, especially in rural areas of our state where maybe there isn't a physician at the clinic they go to, and so we tend to see that very frequently, and along with the fact that some of these providers, especially like our physical therapist colleagues, they're the ones that are working with these individuals on a frequent basis, helping them rehab, and so are more in tune to what their capabilities are versus trying to make a special appointment to meet with a physician for just a certification. So with that, I will turn it over for more testimony, and if I will stand by for questions. Thank you so much.
Okay, thank you. Do we have any other proponent testimony? Good morning.
Good morning, Mr. Chair, members of the committee. My name's Tim Doherty. I'm a registered lobbyist for the South Dakota chapter of the American Physical Therapy Association, and we're here in support of this legislation. As Senator Davis mentioned, expanding the list of providers who can certify applications for disability plates and placards will improve access for patients throughout the state of South Dakota. Most South Dakotans live in areas of the state where there is a shortage of physicians. And by allowing other practitioners who are qualified within the scope of their practice to make determinations regarding disability for purposes of the special license plates and the placards will improve access for these patients. Physician-only certifications sometimes create choke points for patients because they've got to get appointments with physicians who are often very busy. Sometimes if they live in rural areas, they've got to travel long distances for those appointments just to get a certification. Moreover, patients really should be able to choose the clinician that they're already working with for purposes of getting these kinds of certifications. Also, another benefit of this legislation is it'll make these kinds of certifications more affordable for patients. It'll avoid paperwork-only physician appointments for purposes of getting the certifications. And then it'll also reduce the administrative burden for physicians who have to take time away from treating patients to simply meet with someone in order to sign a certification. So we think that this legislation makes a lot of sense. It'll be good for South Dakota patients, and it'll be good for the process. So we'd urge you to support this bill. Thank you.
Okay, thank you. Do we have any other proponent testimony? Good morning.
Good morning, Mr. Chairman. Jennifer Stalley, and I'm here on behalf of both the South Dakota Nurses Association and the South Dakota Academy of Physician Assistants to ask for your support. I would certainly agree with all of the previous remarks and just also add specific to the physician assistants and the nurse practitioners, there's an administrative rule right now that seems to indicate that they could do this, but with this statutory clarity, that makes it certain that they can, and so we appreciate making the statute match the rule. Other than that, we would just agree with all of the previous comments and ask for your support of the bill.
Okay, thank you. Any other proponent testimony?
Good morning, Mr. Chairman, members of the committee. Pardon me, Deb Mortensen, representing the South Dakota Chiropractors Association. We too rise in support of this bill. We think that it would be a great addition to the services that they already offer their patients with disabilities. So thank you for your consideration.
Okay, thank you. Any other proponent testimony? No, we have none online. Any other proponent testimony in the room? Okay, seeing none, we'll move to opponent testimony. That's always nice to see. No opponent testimony in the room? Okay, thank you. So no need for rebuttal. I'll open it up to committee questions. I guess I do have one. It's somewhat generic. I'm not sure who can answer this. Is there a process for someone to challenge somebody's placard, or I guess, you know, if somebody thinks they've got a fake disability and somebody sees them performing things that you shouldn't be able to perform with that, having that disability, I'm just curious. I mean, I'm for this bill, but I'm curious. So,
Mr. Chair, Senator Sidney Davis, I can't speak particularly to a challenge process. I do know that with all of these applications in like the placards, they do have expirations. So they do have to be renewed within a certain time frame. And so, you know, it's hard to, I think each one has its individual expirations and things like that. So the individual would have to go back for, you know, a renewal. I hope that helps.
thank you. I'll just follow up my own question. I'm not pointing fingers at anybody that would certify it. I'm pointing fingers at people that would cheat. Oh, thank you. Any other questions from the committee?
Mr. Chair,
Senator Grove.
for the prime. Was there a lot of, were there a lot of people that were asking for this? Was there like a bunch of complaints, or just like what made you bring the bill?
I think we saw specifically, I think the physical therapists in particular who work with patients from a mobility standpoint routinely were having to, they can speak to the patient's abilities a lot better than maybe a physician that they're only seeing on a, maybe every other month basis or things like that. And so I think there was some patients and providers that were frustrated that they were trying to get them these applications, trying to get them this, get their certifications for mobility purposes, and ended up, you're, live in Madison doing some physical therapy in Madison, for example, but we can't get you in to see the physician for however long to get the certification. Or now that patient has to pay for a paperwork only appointment when the provider that's working with them on a routine basis can speak to their physical abilities they're more familiar, have a better rapport with that patient. It just makes a little more sense that way. And again, we're talking about folks still working within their scope of practice and just their abilities and their qualifications. So I hope that helps. Yep.
Thank you. Any other questions from the committee? Okay, seeing none, we'll close testimony, open it up to committee action and or discussion. Senator Reed.
Thank you, Mr. Chair. I move due pass on House Bill 1104.
Second. Okay, got Senator Reed moves House Bill 1104 do pass, seconded by Senator Smith. Any discussion on your motion?
Thank you, Mr. Chair. Well, this makes a lot of sense, especially in our rural areas. So patients can get this done, and we can share the load between all of our medical professionals. But there's just two other parts in this is why this bill is done very well. First of all, the certification must be within the practitioner's applicable scope of practice, so that covers that someone's not stepping out of what they can do. And then also that the Secretary of Health promulgates the rules defining an individual with substantial physical disability. So obviously then it's not someone making a judgment call on this either. So I think bill's been well done, and I think will be good for the citizens of the state.
Thank you. Any other comments?
If I could, Mr. Chair.
Senator Voigt.
I like the way the bill is written because it gives flexibility to the medical people. Have an incident with the physician and then makes a referral to PEA, follow-up, whatever. And this allows those people that are complementing that the ability to give access to those patients. Docs are really tied up, and to continue that with a patient, they end up backed up and the patients can't get that access.
I agree. I'll comment. It's a good bill. It's a good move because people that are seeing their physical therapists generally see them often, or chiropractors see them more often than trying to get into their doctor to get a certification, because it can take a month to get into your doctor. So I think this is a good bill too. Any other comments? With that, House Bill 1104 has been moved to do pass by Senator Reed, seconded by Representative Smith. All those in favor say aye. Opposed, nay. Secretary, call the roll, please.
Senator Grove.
Aye.
Perry.
Aye.
Reed.
Aye.
Smith.
Aye.
Voigt.
Aye.
Davis.
Aye.
Jensen.
Aye.
Mr. Chair, we have 7 yeas.
Thank you. So House Bill 1104 has been passed. Do pass motion. If there's no objection, we'll put this on consent. Okay, thank you. So we'll certify House Bill 1104 for consent. Thank you. So moving right along, we'll go to House Bill 1143, authorize the possession and self-administration of diabetes medications by a student on school property and at school-related events and activities.
Greetings again.
Yep, proponent testimony. Thank you.
Thank you, Mr. Chair, members of the committee, Senator Sidney Davis, District 17. So here today to talk a little bit about why students that have type 1 diabetes should have access to their life-saving medication at all times while they're at school or a school-sponsored event. So children with diabetes, they're moving through the school day just like any other student. They're rotating to art, music, gym, all of those special classes in different classrooms. And as they get older, they move even more frequently between classrooms. And so we all know this is just a normal part of education, but it can create a real medical challenge. Their medications are often locked in the nurse's office or another central location far from where they may be during an emergency. In a lockdown situation, access could even be more limited. And so when a student's blood sugar drops dangerously low, minutes matter. Severe hypoglycemia can cause confusion, unconsciousness, seizure. If it goes untreated, even life-threatening complications. So nasal glucagon is designed for these emergencies and is extremely safe. Peer-reviewed research shows that even accidental use in like a non-diabetic individual is not harmful. So meanwhile, though, if we delay treatment, that poses real significant risks. South Dakota law already protects students with asthma and students that may be susceptible to anaphylaxis by allowing them to carry and self-administer their rescued medications like an inhaler or an EpiPen. And so students with diabetes, they should deserve those same protections too. This bill simply extends those existing rights to include nasal glucagon, insulin, and other diabetes medications and their necessary supplies. It does not create new burdens for schools or new programs. It simply ensures that students with diabetes can access their medication they need when every second counts. This small statutory change could one day save a life. I respectfully ask for your support on the bill. Thank you for your time, and I'll stand by for questions.
Okay, thank you. Do we have any other proponent testimony? Any other proponent testimony on House Bill 1143. And we have one online. Matt, would you like to go ahead and introduce yourself and begin your testimony?
Thank you. Good morning, Chair Jensen and members of the Senate Health and Human Services Committee. My name is Matt Prokop, and I'm the Director of State Government Affairs for the American Diabetes Association for the Northwest and North Central region. The ADA is the nation's leading volunteer health organization fighting to bend the curve on the diabetes epidemic. Founded in 1940, the ADA is comprised of people with diabetes, healthcare professionals, and research scientists and other concerned individuals. Diabetes must be managed 24 hours a day, 7 days a week. And for children with diabetes, that includes time spent at school or school-sponsored activities like field trips and extracurricular activities. Diabetes does not take a break when a student boards the school bus in the morning. Students with diabetes need access to equipment, supplies, and medication at school to manage blood glucose levels, treat emergencies, and handle daily care. If they do not have immediate access, their health and safety may be placed in jeopardy. The American Diabetes Association Safe at School principles provide that self-management of diabetes should be allowed in all school settings for students with the capacity to do so. Such self-management should include monitoring glucose levels and responding to glucose levels with needed food and medication when utilizing appropriate safety protocols. HB 1143 would allow capable students with diabetes to possess and self-administer diabetes medication like insulin and other necessary medications and supplies to help students manage their diabetes during the course of their school day and at all school-sponsored activities. A written order from a student's parents, physician, or other licensed healthcare provider would also be required, indicating that the student is capable of self-administering and managing the prescription medication and possessing and using other related equipment and supplies. Currently, the majority of states allow students to self-manage diabetes and carry diabetes supplies while at school. This includes the bordering states of North Dakota, Nebraska, and Minnesota. The provisions include in HB 1143 would ensure that South Dakota students can safely and effectively access and administer diabetes medications and supplies to manage their diabetes during the school day and while attending school-related activities. We ask the committee to advance a do pass motion for HB 1143, and thank you, Mr. Chair and members of the committee.
Okay, thank you. Do we have any other proponent testimony? Okay, seeing none. Do we have any opponent testimony? No, seeing none. No need for rebuttal, so I guess we'll open it up to committee questions. Senator Perry.
For the prime. And you can phone a friend if you want, but diabetes has become a bigger area that we're working on. What percentage of students are type 1 or type 2?
Mr. Chair.
Go ahead.
Senator, I do not know that information, but I will say that this bill was inspired by some constituents that came forward that child is type 1 diabetic. You know, this is different than, this is more applicable to children. This is something you're usually born with or you develop as a child. And so this is different than type 2 diabetes, right? And so these individuals are even more reliant on these emergency medications. And so the bill, as far as safety provisions, they have to have permission from the parent and a licensed provider saying that they are capable of administering their emergency medication. This just puts things in line with just the same as the students that might need to carry their asthma inhaler or their EpiPen because they're maybe severely allergic to peanuts or whatever it might be. So I hope that kind of, sorry, I don't have that data in front of me.
I know that it's increased. I'm sorry. I know it's increased. I just didn't know if it's 2%, 4%, what it is. But I know it's higher than it was at one point.
Thank you. Any other questions from the committee? Okay, seeing none, we'll close questioning and open up to committee action or discussion. Senator Perry.
I'll go with action, and that would be motion for a due pass.
So Senator Perry moves to pass. Do we have a second? Senator Voigt seconds. So the motion by Senator Perry do pass on House Bill 1143, seconded by Senator Voigt. Any comments on your motion?
It's very simple. Self-administration of diabetes medication is very important. It makes a difference in people's lives and how they live and how they can be a student and be a better student. So this is something that really makes sense, and it looks like previously the other area of our state said it's a good idea too, so I think it's good.
Any other comments from the committee? Yes, the other house was unanimous, I guess, or pretty much, I think, close to it. With that, we have a motion by Senator Perry to do pass on House Bill 1143, seconded by Senator Voigt. All those in favor say aye, opposed nay. Secretary, please call the roll.
Senator Grove.
Aye.
Perry.
Aye.
Reed.
Aye.
Smith.
Aye.
Voigt.
Aye.
Davis.
Aye.
Jensen.
Aye.
Mr. Chair, we have 7 yeas.
Okay, thank you. House Bill 1143 will go to the floor with a do pass motion. Any objection to consent? None, so we will certify this for the consent agenda. And this is Senator Davis Day.
It
So we
sure
will move on.
is. It sure
We will move-
is.
We will move on to House Bill 1146, adopt the physician assistant licensure compact. Do I have any proponent testimony?
Yes, thank you, Mr. Chair. Senator Sidney Davis. Back again. All right, so HB 1146. We've seen a lot of licensure compacts come through the legislature, and so we've got one more for you guys. For our colleagues and good friends, the physician assistants. So this is structured similarly to our other medical licensure compacts that we already are operating successfully in South Dakota. That would include the RN, registered nurse, licensed practical nurse compact, and then also the advanced practice registered nurse compact. The PA compact creates a streamlined pathway for physician assistants who hold active licenses and meet a national certification requirement to obtain a multi-state license and practice across those participating states. Currently, South Dakota has just over 600 licensed physician assistants. This is a small but critically important workforce in our healthcare system. Nationally, there is 126,000 PAs, and the profession continues to grow rapidly to meet patient demand. In a rural state like ours, every single provider matters. Increasing mobility for this workforce directly strengthens access to care in communities that struggle the most. Like all healthcare licensure compacts, the goal here is simple. We're just looking to improve high quality care or access to high quality care, especially in our rural and underserved regions, by removing the duplicative administrative barriers of holding licenses in multiple states, while we would still maintain a strong state regulatory authority. PAs practicing in South Dakota under the compact still remain fully bound by our state's scope of practice laws, supervision rules, and all other applicable laws. So at a time when workforce shortages continue to be one of the greatest challenges that we see facing our healthcare system, this compact is just a practical, proven tool, helps widen the pool of eligible applicants and allows providers to get to work more quickly. This offers, meaningful support too for our military families who have to relocate frequently, as well as PAs who serve patients across multiple states. So you'll hear from a few more others on this topic, but again, would ask for your support. Thank you.
Okay, thank you. Do we have any other proponent testimony? Good morning, Secretary.
Morning, Melissa Megstead, Secretary of Health. I'm so glad to be here on Senator Sidney Davis Day. It's so exciting to be here today. And as a nurse practitioner practicing in the States, I love all the bills of this morning. I think I like what you're doing over here. But as a secretary, I'm here to just support this particular one on workforce. South Dakota has a long history with compacts. We have had the nursing compact for over 20 years in our state, and over 500 nurses work in South Dakota based on a compact. So with a state with workforce challenges, honing and using the compact as another tool in the toolbox has proven to be successful for us in this state. And so we're I was happy to support the PAs joining in the group of health professionals that already practice at compacts in this state. We've had quite a few of these come through the last few years, and I think it's a great trend, and I appreciate that these compacts reduce the barriers to workforce, especially if you live close to the border. Having practiced in the state for many years, I've used a compact when I was practicing over across the border in the state of Iowa. So very useful, very impactful, glad to support it. Thank you.
Thank you. Do we have more proponent testimony? Good morning.
Good morning, Chairman Jensen, members of the committee. Thanks for the opportunity to speak today. My name is Kayla Frank. I'm a practicing PA in Sioux Falls. I'm also the legislative chair for the South Dakota Academy of PAs. I want to thank you for your support of our practice legislation last year. It made a meaningful difference for our patients and PAs already in South Dakota. HB 1146 builds on that progress. The PA licensure compact increases flexibility for PAs to relocate or provide care in South Dakota, especially in rural communities where every available provider matters. Doesn't change our scope of practice, lower licensure standards, or reduce South Dakota's authority. Our state keeps full control over licensing and disciplinary issues that arise. A simple analogy helps. Licensing keeps everybody safe, but I don't apply for a new driver's license every time I cross the border into North Dakota. I follow North Dakota's highway laws. Information is shared between states only to protect public safety and identify bad actors sooner. We don't require redundant registrations to drive, and it's just like last year's highway analogy we used with the PAs. We have our established lane with the correct guardrails in place for that. The PA compact simply provides the privilege to reinforce South Dakota's PA workforce flexibility and improve our interstate driving. For a rural state like ours, PA compact is practical, low-cost way to expand access to care, strengthen our workforce, and support patient safety while keeping full control right here in Pierre. And I respectfully ask for your support of HB 1146. Thank you.
Okay, thank you. Do we have any other proponent testimony?
Good morning, Mr. Chair, members of the committee. Eric Nelson. I am Government Relations for AARP South Dakota and serve as our registered lobbyist. AARP is the consumer membership organization. We have nearly 100,000 members in the state of South Dakota, and we advocate for our state's 50-plus population. I rise before you today and ask you to support House Bill 1146. We feel that the PA Compact will offer a streamlined approach which improves healthcare access while maintaining public health and supporting employment opportunities for PAs. South Dakota has a growing population of older adults, and it's critical for them to have adequate access to healthcare providers. Joining the PA Licensure Compact will not solve all of our problems with healthcare access, but it is one step we can take towards making sure everyone in our state can access the care we need. I've been up here before you guys before and then shared with you that we do outreach to our members, we do surveys to our members, and the things that they tell us are most important to them is being able to age in their community, being able to age in their home, and have reliable access to health care. We feel that this bill is an important step to meeting those objectives for our members and your constituents, and we ask you to support the bill. Thank you.
Okay, thank you. Other proponent testimony? And good morning.
Good morning, Mr. Chair, members of the committee. My name is Jacob Parsons. I'm a registered lobbyist on behalf of the South Dakota Association of Healthcare Organizations, representing all nonprofit hospitals in the state, as well as about half of all long-term care providers. When we ask our members what their issues are every year, the number one issue we hear about is workforce. And so we see this just as another tool in the toolbox for them to be able to find and retain those qualified applicants for their positions. So with that, we'd ask for your support. Thank you.
Thank you. Other proponent testimony? Okay, seeing none, do we have any opponent testimony? Okay, seeing none, no need for rebuttal. Open it up to committee questions. No questions, seems pretty straightforward. So we'll close questioning, open it up to committee action and/or discussion.
Mr. Chair, I move due pass.
Senator Smith moves due pass on, forgot the number already. 1146, okay, thank you. Senator Smith moves due pass on House Bill 1146, seconded by Senator Grove. Any comments on your motion?
I think this just falls in line with other compacts in our state and what we do, and it makes perfect sense.
Okay, thank you. Any other comments on the motion? Senator Perry.
The one thing that we find on HB 1146 is that it is very detailed and it is well put together.
Okay, thank you. Any other comments? So the motion before us is due pass by Senator Smith, House Bill 1146, second by Senator Grove. All those in favor will say aye, opposed nay. I'll ask the secretary to call the roll.
Senator Grove.
Aye.
Perry.
Aye.
Reed.
Aye.
Smith.
Aye.
Voigt.
Aye.
Davis.
Aye.
Jensen.
Aye.
Mr. Chair, we have 7 yeas.
Okay, thank you. So House Bill 1146 will move to the floor with a due pass motion. Any objection to consent? Saying none, we'll certify House Bill 1146 for consent. Thank you. And with that, sorry we got done quickly. And you all get an hour and a half break here. If I'd have known that, we could have started at 8:30 or 9:30. I'll ask for a motion to adjourn.
Mr. Chair, before that,
Yes, go
Do you
ahead.
have plans for? Do you know what you're going to do on Wednesday yet? Are you planning on having a meeting on Wednesday?
This Wednesday?
Yeah.
Yes.
Okay, just
We have
wanted
3
to know.
bills scheduled for Wednesday.
Thank you. I'll move to adjourn then.
Okay. Senator Reed moves to adjourn, seconded by Senator Perry. All those in favor say aye. Aye. Opposed, nay. We are adjourned, and thank you all.
From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts Programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota Legislature and in-depth reporting from Pierre. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from Peer. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB. Good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from peer. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB.